Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. Today we have a very interesting topic, and it is on complementary therapies. I think this will interest you very much.
The basic principle of cure is that the innate potential of the person has to be tapped, and favorable conducive environment has to be created where the healing takes place. So for this, it is better to have almost all possible therapies working together and complementing each other. This is understood by every system, that unless the innate healing potential of the person is tapped, the healing can never be effective. The basic principle of treatment or therapy is that the therapy has to be very gentle. It should be sustained relief, that is like a permanent cure, and it should be as rapid as possible. So to achieve these qualities of cure, we need to complement different systems together. I can give you one example. What we call naturopathy, nature cure therapy.
Yes.
That creates a favorable background for the cure to take place in the person, especially in chronic illnesses.
Especially
In chronic illnesses, where the illnesses are chronic. And therefore, if the person is on proper diet, person is availing adequate proper sleep, then has what we call a cleansing of the system, as naturopathy proposes, the cure will be smooth going for every therapy. It doesn't matter what you are using. It can be homeopathy, it can be Ayurveda, it can be Unani, it can be Siddha, Yoga, whatever. But if the favorable background is created in the person for cure, the cure will be instant. It will give instant results.
Now you speak about the innate aspect. Where does faith come in here?
Yes, see, each cell in our body is equipped with what we call self-preservation. Any antagonistic influence in the form of antigen or infection and all, body has mechanism to retort it, to avert it, to nullify it, to resolve it. So this potential is there in the person, and that's what we call innate potential of the person to heal oneself.
And it's there in every person?
That is there in every person, in every cell of the person, every cell of the person. And this is the prime thing for cure. You can't render or avail proper cure procedure without involvement of this potential or this system. Otherwise, it will be just a palliation or a suppression. This is what we feel. Sometimes what we call so-called terminal illnesses or advanced cancerous conditions, we just go on palliating things. And that palliation makes the things more like worse rather, or aggravated, because many diseases are always symptoms which are indicators of the healing phenomena in the body, like catharsis or discharges or diarrhea. And if we palliate it, there would be definitely a turmoil. For example, suppose someone has a food poisoning, And because of food poisoning, the first reaction of the system will be to purgate it out, to have a diarrhea and remove the toxins, or vomit it. Vomiting will be instant and it will be more efficacious. But if it has already gone in small intestines, then there will be diarrhea, loose motion, dysentery, whatever is the norm.
Just while we're on this subject, we years ago in the early 1970s, we had a young man, his name was Mark, and he collected a bunch of mushrooms in Oroville and cooked them and became so sick that they rushed him to the hospital and they pumped out his stomach.
Exactly.
Is that what they do?
Yes. So nature also does it. That's what I wanted to tell. Like if
okay.
you eat something which is odd and body can't take it, it's not palatable to the system, our system will cause purgation, diarrhea, loose motion, and throw it off. Now imagine if someone has eaten a contaminated food and the toxins are being thrown out in the form of diarrhea, and we suddenly give antidiarrheal. Now, if you give antidiarrheal, the toxins will not be emitted out, they won't be excreted out. So, it will be hazardous to give a palliation. So, we have to always have a system which will facilitate the cure process. Always. So, we have come across cases. There was a sort of whole colony got affected with cholera like infection, and in our town 150 cases got admitted in medical college with gastroenteritis, diarrhea, loose motion within one night. And everyone, just few pins of IV fluids were given treatment, diarrhea, and it stopped, and within like 24 hours to 36 hours everyone was discharged, cured. Just they were provided fluid, that's all, and body cured they got cured. Only 2 cases were resistant, they did not get cured. And then we were eager to know like why this in this, and that to relatively young persons. And then we realized that this person was owner of a medical store. So looking that he has diarrhea and his wife has diarrhea, he took antidiarrheal as a first thing. And this couple did not respond well to the IV fluids and supplements and treatment. And the reason was this, that palliation without realizing the dynamics of the system, innate system of cure. So, in every case, we have to understand that there is a innate, inbuilt system, mechanism. For example, if a case of hypertension comes, severe hypertension, good physicians will never control it in one go. If it is severe hypertension, and we have seen that one person was brought to our clinic with bleeding from nose, and when we were rushing to the nose to pack the bleeding, our professor shouted, "No, check his blood pressure first, and don't stop the bleeding." And we checked the blood pressure, and it was too high. So this was a vent found out by the body to avoid cerebral hemorrhage. So it's like a vent. So we have to always understand the body phenomena where body is trying to overcome the disease, and we have to always complement that. So we did not go for attending the epistaxis, but we started attending the blood pressure. And not only that, the professor said we can't give the person antihypertensives so suddenly in such a dose that his blood pressure is brought to normal. No, it should be gradually lowered, not suddenly. Even body won't tolerate that shock. So we have to always plan the treatment in a composite way. And therefore, I remember this very popular book on nature cure. And one American healer, Henry Lindlar, he has edited this book. It's good old story. I think it must be in the beginning of the 20th century, 1913 or 14, he published this book. There he has given all the details, like how the nature cure takes place. And there he has written that body has system to overcome any disease. That system is activated as a feedback mechanism. Only thing is, sometimes this system needs a crisis for cure. And there he has written one chapter and he has given so many incidences where homeopathy is applied to give this crisis, healing crisis, he calls it. And he has written that homeopathic medicines or the system can give most subtle crisis where there wouldn't be turmoil, very smooth going crisis. So he says that if we combine these therapies together, the cure will be very much smooth going. He gives another example. Like, see, these energy healings, especially acupuncture and acupressure, these healing systems, they can just correct the flow of energy and give instant relief. But that relief will be functional. Functional in the sense, suppose there is a sciatic pain. The pain will be relieved with the acupuncture or acupressure points. But it may not remain permanent, because the involvement of innate system, the original potential of the person is not involved in eradicating the cause of wrong energy flow or blocks. And therefore, in that case, what he advises is you give non-chemical. See, acupuncture and acupressure in China, so there are stories where they don't give anesthesia. Under acupuncture, they operate, and even crucial surgeries they conduct with anesthesia caused by acupuncture and acupressure without applying any chemical. So instant relief is there. At the same time, you give homeopathy to create crisis, and naturopathy means it involves a diet and hydrotherapy and sun bath and sleep and position, yogasana, breathing exercises together. So if this is the way how things are complementing each other and applied, there it will be a most rapid, gentle and permanent cure. What we call ideal cure should be this, that it should be rapid, gentle and permanent. If we complement all these therapies together, it will be wonderful.
What other kind of complementary therapies are there?
I remember one homeopath from Calcutta, he used to combine even allopathy and homeopathy together.
Oh.
What he used to say is that by chance someone's immunity was compromised for a while and organisms have become very much virulent and they have taken possession of the whole organism. So this allopathic doctor, what he used to do, where the organisms are very much virulent and already the disease is so advanced, the infection is so advanced, where it won't be possible for the system of the patient to overcome it on its own, what he would do is he will add specific antibiotics which will have bacteriostatic action. Bacteriostatic means the antibiotics won't, it is not bactericidal. It is bacteriostatic means where the multiplication of the bacteria would be stopped. They may not be killed. So multiplication will be stopped, bacteriostatic action will be there, and so multiplication of the bacteria will be stopped, and then homeopathic treatment would be added for original ailment where the virulent infection also is controlled, and the original susceptibility for the infection also is cured with homeopathy. So he used to combine both the therapies together. I have seen one more instance where a child having lot of worm infestation, already child was almost in malnutrition because of that. Now in that case, in general, we advocate homeopathic treatment to remove the environment in the intestinal tract which harbors worms. So, to give that, like we give medicine on the basis of totality, and that environment goes off where worms won't thrive. But the worms which already are there, how to deal with them? So then he studies the nature of worms and gives deworming which will suit to the person. Because we have seen that in children, if you give a wrong dose of deworming, the worms also realize that there is something which has come which is antagonistic to them, and they coil up together. And they coil up together and form intestinal obstruction, and that can be fatal also. So, very carefully, all these things will have to be combined, uh, therapies together, and definitely the cure process will be smooth going for the patient.
Now, let's take a patient who has third or fourth stage cancer, and they truly want to overcome it,
Yes.
but they can't.
See, it's very interesting to understand like what stage means. See, staging is perfect. Okay. Now I'll tell you two instances where we have two patients who are in fourth stage, where it is quite advanced stage, stage 4. But in one instance, this stage 4 is reached after 10 years of malignancy. The person got initial malignancy, say, before 10 years. I'm talking from hypothetical point. And he has reached stage 4 after 10 years. And there is another person who is also in stage 4, but hardly within 6 months he has advanced into stage 4. So here the pace of the disease is different. When pace of the disease is slow, it indicates that there is inner resistance for the disease in the person, which is activated, and therefore it is contained and it is the pace is slow. Whereas in other person, disease has total freedom, and with a very fast pace, it has advanced to stage 4. So treatment prognosis will be different even in the same stage.
Yes.
So much depends upon own vitality, or we in our dynamic term, will and understanding of the inner entity. And if that is strong, that can start reversing. It can stop advancing. It will give good respite to the person. So we have seen that even in situ carcinoma, in the initial stage where everything was differentiating, the persons have progressed in malignancy and they never got relief. Whereas the person who has reached stage 4, but his vitality and will, everything is strong, then he responds to the treatment, and that reverses. There are cases. So there are specific individualistic prognosis is there in a terminal, but combination of all these therapies does make the life smooth going. A quality of life also is better. It reverses, it's painless, like what we do generally in terminal pathology, we call it in advanced stage. There we do allow them to take local painkillers to tide over the pain, because suppose there is agonizing pain and person will not be able to have sleep and respite and hibernate, how person will survive? So we allow local management and then give homeopathy along with natural herbal therapies and all with pain. And we have seen that there are better results. At least palliation is better.
And you haven't mentioned Ayurveda.
Yes, Ayurveda and homeopathy, they are very similar. Similar in the sense that in Ayurveda also they consider Prakriti, These are basic tendency, disease producing tendencies: Prakriti, Pitta Prakriti, Vata Prakriti, and Kapha Prakriti. And those Prakritis combine together to give rise to certain form of disease in the person. So in Ayurveda also, this Prakriti combination has to be treated. Then only the person will get all right. Be it in skin, be it in respiratory, be it in musculoskeletal. The approach is this Prakriti based approach. Same is in homeopathy. The terminology is little different. In homeopathy, we call it miasms. So, psora, syphilis, and psychosis. These are three miasms which are busy disease producing tendencies, and combination of this, part of it is inherited and part of it is acquired, and it causes all ailments. So, one has to approach this combination for treatment, then only there will be permanent relief. Same thing is with Ayurveda also. And in Ayurveda also, there are medicines prepared from minerals, from plants, from even animal products. Same is with homeopathy. Only difference is in homeopathy the medicines are highly attenuated, potentized, dynamized. That's all. That's the only difference. That's why sometimes we call homeopathy is just a refined branch of Ayurveda. Just a refined branch of Ayurveda. And even Hahnemann has given references of these procedures in Organon and Philosophy. And from that time also, surprisingly, now Ayurveda has become very popular in Germany. People there, the institutions, they are many students who study Sanskrit and original Sanskrit, they read Ayurvedic literature and study it, and they are really doing well.
Wonderful. Namaste. And thank you for listening.